Thanks. Hello, everybody. So I'm very happy to have the opportunity to present today collective research that have been done with the community. So this research has been conducted with Sophie Leila Kondopoulos, Karine Bertrand, and the Polytux group, who is an activist group that is based in Marseille, in France. So the title of my presentation is Gender and Drugs, Experiences of Stigma, Toxicophobia, and Narcofeminist Narratives, and it echoes to what has been discussed just before in the community leadership session. So I will begin with some background. So women who use drugs are often presented as vulnerable subjects, objects, through a biological lens, but in practice, relationships with drugs are intertwined with political and social systems and involve social relations of gender and oppression that need to be explored in order to go beyond an approach that focuses exclusively on biological vulnerability. Through feminist collectives, women can reclaim their individual stories, including traumas and victimization, via an auto-ethnographic narco-feminist approach that denounces relations of oppression, produces new subjectivities, and invents new forms of resistance to discrimination, according to the work of Elisabeth Ettore. So there is a recent ethico-political narco-feminist movement that comes from the community and was also very inspireful for scientists. And this narco-feminist movement emerged to defend the rights of movement and gender minorities who use drugs. It was created by activist groups of people with lived experiences, by the Eurasian Harm Reduction Association, the International Network of People Who Use Drugs, and National Urban Survivors Union in the United States. And now the narco-feminist movement has also emerged in several local European settings. So narco-feminism is a political response that collectively aims to build a world free of stigma, violence, and oppression, by publicly invoking our bodies, our choices, our rights, our voices. It has been inspired by feminist approaches, the work of Elisabeth Ettore, and narco-feminism pursues activist strategies of resistance to a patriarchal world dominated by a prohibitionist drug policy regime. So my presentation today is based on the Gender Harp research project. So Gender Harp is a transnational social science project that includes Belgium, France, and Canada. It has been funded by the European Union, and it has the objective to develop contextualized knowledge that can enhance the integration of gender-responsive services adapted to care and social needs of women who use drugs that are in line, and these programs are in line with harm reduction approaches. So the other objectives of the project were to listen to the voices of women with lived experience, to guide long-term integrated services that take gender into account, to identify specific vulnerability produced by the political system of prohibition, and finally to enhance capacities that people may develop at individual and collective levels. So we did a sociological qualitative study embedded in a community-based approach. We conducted semi-structured interviews on substance use and recovery trajectories within a harm reduction approach. The sample was diversified according to age, gender, sexual diversities, profiles of substance use, types of service utilization. And today I will focus my presentation on the part of the research that has been conducted in France. So in France, we did 61 individual interviews and 12 collective intergroups with 15 activist groups members in Paris, Marseille, Bordeaux, and in Guyana. We did a thematic analysis guided by the intersectional approach and Peterson's gender analysis framework. So I will now move to the analysis. One of the most important results of our research was to highlight how substance use intertwined with gender norms. So in our research, it appears that being a woman using drugs implies systematically social reprobation linked to gender norms that consider women to be vulnerable people. Two main types of specific gender attributes or expectations were mentioned in the individual narratives, those of fragility and those of moderation, which are imposed on women in the different social spaces of their lives. In care, but also during social events or with friends. So I will now mention two quotations of our work. So a woman say, when you are a woman, people will tell you to drink less because you are more fragile. Another say, it's something that's passed down from mother to daughter. I heard my mother say, a girl doesn't do that, to take drugs. A girl has to be like this, a girl has to be like that. So regarding substance use and gender norms, women who use drugs also report that they are constantly reminded of their reproductive function or motherhood role. All of the individual narratives reported a feeling of guilt, responsibility, whereas the collective discourse that we collected during this narco-feminist project produced new narrative emphasizes how these normative discourses distance women from care. For example, during the collective work, women say, this reminds us the importance of the normative discourse of health professionals in relation to drugs and gender, regarding the mother figure which is put across during medical consultations, making it difficult to have a non-judgmental dialogue about drugs. During the collective groups, women who use drugs also highlighted the sexist discourse they constantly have to endure in connection with their drug use, due to people constantly referring to their physical appearance and attractiveness. A woman said during focus group, one thing I have heard a lot, not from doctors, but from people who have met me, even drug dealers. Well, people I have met in the train, for example. When I've told them a bit about my life or who I was, they have always said to me, it's a shame you take drugs, you are so pretty. If I would have been old and ugly, I could have injected myself into the gutter until I died. I have heard that at least 15 times, as if when you are cute, you can't do that to yourself, taking drugs. Another important topic that emerged from the research was the link between drug use, mental health, and attitudes of toxicophobia. So women who take part in collective groups say they avoid individual contact with many health professionals because they consider their discourses to be a form of toxicophobia. They don't want to have to put up with any more discourses that oscillated between, open quote, infantilization and false benevolence. A woman relates an experience she has to face before being welcomed in an hospital for a mental health issue. She said that she met a psychologist at 10:40 a.m., and the psychologist said to her, "You have ruined your body." And she answered, "It's tiring having to make a list of the drugs you have taken every time you go into an hospital. I don't understand the point of this list that forces us to list the things we consume as a condition to attend the hospital. This is a Trojan horse of goodwill. You have to stop taking drugs if you want to go to the day hospital." The typical sentence that I have heard is, "We won't be able to work together if you turn up drugged." It's like having to choose between your mental health and your drug habits, when in fact they go hand in hand. There is always a duality between infantilization and false benevolence. They, professionals, health professionals wanted to replace drugs with benzo, but now I'm addicted to benzo. It's insufferable. Regarding drug use, mental health and toxicophobia, during the collective groups, women highlight that they don't feel that their experiential knowledge with drugs is being taken into consideration in their care trajectory. So they said, according to psychologists, I'm unwell because I'm on drugs, whereas with benzo, there are ups and downs. Then don't ask me why I am taking ketamine when it's a great antidepressant that doesn't take you down so much. We should be working with it, ketamine, instead of excluding it. Another said, I haven't been told that as long as I take drug, I will be in trouble. Even so, addictions are part of who I am. At a French psychiatric hospital, they told me, you can't work on your mental health if your brain is altered by drugs. According to them, health professionals, first I had to stop, and then I had to treat myself. It's not at all about acceptance, especially as the legal drugs also get you high. People don't know anything about drugs, but they always think they know better than us. Another topic that was very important in the research was the importance to reintroducing pleasure in care. During the collective groups, many of the women asked that drug use not be systematically classified as an addiction which suggests unregulated and negative behaviors and chaos. Some of them also highlight that being addict can also include experiences of pleasure. So women say during the group, I think you can also experience pleasure in addiction, even if you are an addict. For me, that doesn't mean it can still be pleasurable. They are calling for drug treatment services, taking into account in care that sensation of pleasure and the positive experience that drugs can bring. A woman says, personally, I know that when I drink, the trick is to try not to become addicted, to stick to something I enjoy. In fact, that's not necessarily what I do, but in any case, I try to enjoy myself. Another say, for me, the real problem with drug use is addiction. That's when it becomes a problem. Otherwise, using drugs is not a problem. Another topic that was very important during the narcofeminist process is to highlight that there is a need to change the narrative about stigma and people who use drugs. So based on the narcofeminist process, women are building a collective story situated within logics of empowerment with the idea that disclosing experiences of drug phobia in written form can make representation evolve. So during the group, the woman said, there is the idea that addicts are liars, but we are forced to lie because the drug phobia that makes us hide. People who use drugs are always expected to adjust to suit to other people, but society should work on representations, while users are systematically put in a position where they have to justify themselves to apologize for drug use. These guilt-inducing representations are particularly significant for women and can lead them to avoid asking for help, to hide their drug-using practices, and to be less well-supported in their harm reduction and recovery process. To conclude, our research underlines how unequal gender services perpetuate gender inequalities, with experiences of stigmatization or lack of safety in the context of care, with an accumulation of stigmatized identities that accentuate barriers to care. Transformative services were rarely reported, but when they have a significant impact on harm reduction and recovery pathways of women. But the problem is that in France, in my country, these services still tend to focus on mothers, only mothers. The narcofeminist process allows to move from individual vulnerabilities to structural changes, and women benefit from group work aimed at empowerment to acquire skills to address the difficulties they face collectively and overcome barriers in access to care and harm reduction. Thanks to narcofeminism, women who were initially victims of oppression on the grounds of their gender or sexuality can reappropriate their narratives through a process of autoethnography and collective sharing that enables them to move beyond the discriminatory classifications produced by norms external to feminist worlds. These individual narratives then become collective through self-support groups, enabling women to put forward their experiences and knowledge to denounce oppressive relationships, to produce new subjectivities, and to invent new forms of resistance. Collective stories of empowerment enable women to restore their capacity to take action, but we also need profound structural changes, the implementation of gender transformative services, and a mood toward less discriminating representation of people who use drugs are also required. To finish, I would like to thank the international team, partners, and research participants that make this research possible. Thanks for your attention.